We locked the front door. I will never forget that in my career. We locked the front door for safety reasons, and then we realised we'd shut the door on probably one of the most vulnerable populations in society.
The doors of this Edinburgh surgery didn't remain closed for long.
We're just up at the end today, so it's all one way.
GPs instantly adapted to treat patients and keep their practices COVID-free. This is the lockdown legacy. The days of the full waiting rooms are gone. Attendance is limited.
A wee bit anxious recently.
Yeah, of course.
With things and that, but
Does that tend to make it a bit worse?
yeah, I'm a wee bit stressed.
Yeah. Right at the start, in about April, I remember us having a conversation and we said, there's a lot of people we're just not hearing from that we normally do, who we know are vulnerable, and our care coordinators made phone calls to them. We referred some people on to food banks, we linked them in with a welfare advisor, and actually the overwhelming feeling was that they were just so pleased that we had made contact.
Hi there, how you doing? Tried to call you earlier, I was a bit worried. You didn't pick up, is everything okay?
Calls regarding mental health have skyrocketed. 2/3 of consultations in this practice deal with people's concerns.
The most interesting change I found since probably the beginning of October is the huge increase in contact from people who have never experienced mental health problems before. Lots of health anxiety, lots of men with depression who would previously be working, going on their holidays, looking after their families, had a full sense of purpose in their lives, are really at crisis. We're at this point where lots of people are still okay, but how are they going to be in January?
From a drop in consultations in March, this practice in Glasgow's Govan saw a dramatic rise in patients of almost 70% in August. Doctors are worried some are still not accessing services.
Patients, I suspect, will be presenting later. I worry that our more complex patients, the ones with multiple problems, the ones that a telephone consultation is not appropriate for their needs. And I suspect that we're building up a great deal more unmet need in the population that we serve because of this.
Both these surgeries pride themselves on acting as community hubs, essential in such times of uncertainty.
I do get a bit anxious, and some days I'm generally quite fed up, to be honest with you. There are days when you do feel, is this ever going to end?
I think it's going to be the toughest winter of my career, if I'm being honest. And that's not, trying to be unnecessarily catastrophic, but I think it's going to be really difficult. And we've been trying to restart a lot of NHS services in the last couple of months, and that now feels quite difficult.